Hi, welcome to another episode of Medical Tattva. And Medical Tattva this time brings to you a prominent pediatrician from Mumbai, and he is Dr. SAILESH Gupta. Dr. SAILESH Gupta, you've seen him also before singing, but this time he's going to talk to you about a subject on pediatrics and that too constipation. Let's hear it from him.
This video is to explain why constipation happens to children and what you can do to fix it. Sometimes constipation shows up as large, hard stools that are painful to push out. Some children go days or even weeks between normal bowel movements. Some children with constipation have bowel movements every day. It can cause a lot of other symptoms in children, especially abdominal pain, nausea, poor appetite, soiling or poo accidents, blood in the stool, and even bladder infections. Every child is different, and not all children show obvious signs of constipation to their caregivers. This makes constipation a sneaky problem. Most often, it has been going on a lot longer than we think, even for years. Most often, the problem starts when a child is very young, sometimes even less than 1 year old. What happens first is that a child passes a painful bowel movement. The child's response is to hold the next poo in as long as possible to avoid any more pain. Since the colon is always sucking the water out of the poo inside, the longer a poo is held in, the bigger and harder it gets. When the next poo finally comes out, it hurts even worse. So the child holds the next poo in even longer. This makes the next poo even bigger and even more painful. This is the cycle of constipation. Developing a habit of holding in poo creates a bad problem. Older children hold in poo to avoid using the school toilets, or so they don't have to stop playing. Some children show outward signs that they're holding in their poo, but others don't. The problem with holding in poo too long is that the colon gets bigger and more floppy over time. It's like blowing up a balloon and letting the air out over and over again. Some children pass very large poo that clogs the toilet. This is an outward sign of how big and stretched out things are on the inside. At this point, children may not have a strong urge to go poo. This is what makes constipation a sneaky problem. Your child can walk around all the time full of poo and ignore the feeling that the colon is full. Constipation can get worse and worse over many years without the family even noticing. The colon is a muscle. When it's stretched too far, it gets weaker. This makes it harder for a child to squeeze all the poo out. Some children may start to leak poo into their underwear without even noticing it. Small liquid poo can come out in between big hard poo. This is like water flowing around the rocks in a stream. Signs that the colon is full and overflowing include poo accidents or dirty underwear. So to summarize, chronic constipation happens when poo is held in over and over. The colon gets big and floppy. Your child walks around full of poo without feeling it and without a way to empty it.
Hi parents, I am Dr. SAILESH Gupta, a pediatrician in Mumbai. In my daily practice, at least 10 to 12% of parents approach me for a solution to their child's constipation. A constipated child is one who does not pass stools for several days together, or passes very hard stools, or has difficulty in passing stools. That is, stooling is painful for the child. And this constipation gets complicated by the fact that when a child passes hard stools, it injures the anus and it leads to anal fissures, which are very painful. So this child refuses to pass stools, and the stool that remains in the large intestine hardens further, and it kind of potentiates the problem. It creates a vicious circle. So the child refuses to pass stool, it becomes harder, it becomes more painful, and this vicious circle is what we need to break with our intervention. Now there are several causes for a child getting constipated. If an infant and then a toddler is fed more on milk diet, especially if he is bottle fed and he does not take enough fibrous food which is needed to form stool. So he's not eating grains, he's not eating vegetables, he's not eating fruits. So these children tend to remain constipated. And then there are some lifestyle changes that can happen in a young child's life that can lead to constipation. So joining a play school where he's not comfortable sitting on the toilet in the school. He does not get to drink as much water as he drank at home. The weather is hot, he's sweating a lot, so there's not enough water in the intestines. So all of these can lead to constipation. Then stress in a young child's life for whatever reasons. Even going to school is stressful. There are those playful children who are so engrossed in play that they actually ignore signals to defecate when they want to pass stool. They ignore it, they continue to play, and the stool becomes hard and they get constipated. Then there are those shy children who do not wish to go to the toilet. Then there are those stubborn children who refuse to go to the toilet. So various conditions can lead to constipation. But it's treatable. We can treat it with love and care, with the right kind of instruction for parents and for the child. And that is what we are going to discuss today. So the first line remedy for constipation becomes: do not bottle feed your child. Do not continue to give only milk beyond 6 months of age. Introduce foods that the family would eat. Okay, so that the child learns to eat, and by the time he's 9 or 10 months, he's taking in enough fiber to form soft stools. Bread and biscuit, which are not whole grain products, these tend to cause constipation. Give more fruit, more vegetables. Okay, so best is to give home food. Now Indian food is a good combination of grains and vegetables and fruits if we follow our culture. So if we do that, these children are not likely to get constipated. But those that are resistant to this first line treatment may sometimes need to take in stool softeners or laxatives for a short period of time so that they can pass soft stools and the fear of stooling disappears from their minds and the anal fissures heal so that stooling is not painful for them. So this basically is the treatment for constipation. Good way of avoiding constipation is to toilet train your child at the right age. So let's say beyond 18 months of age, when your child is mature enough to understand your instructions, is familiar with the toilet at home, we can start what is called a toilet training process. Now a lot of parents get very worked up about toilet training. When should we start? What is the right age? Will the child respond? And those parents get so anxious that they transmit their anxiety to the child, who then refuses to cooperate with the whole process of toilet training. So I want to tell you today, it's easy. So take it easy. Do it with love and care. Do not push your child into a corner to make him pass stool. You are the coach. So be a loving coach. You're the right person to help your child through this process of toilet training. So we'll tell you how to do it. Clever and cooperative toddlers, we can actually start the process of toilet training by about 1.5 years or 18 months of age. But definitely in most children, we can start toilet training between 2 and 3 months of age when they are able to understand our language, our instructions, and cooperate with us. So what we should do is familiarize them with the toilet pot. And we can do this by introducing words like poo and pee and susu and potty in our daily dialogue so that they understand this means emptying out the bladder or the bowel. We need to kind of instruct them or tell them that whenever there is the urge to pass stool or urine, they could come to the parent, come to us, and then we should gently lead them into the toilet where the passing out of the stool and the cleaning up is done, so they understand that this is the place where we need to empty ourselves. So they may not cooperate completely in the first few days, but we need to give them time, be patient with them. Do not punish them because they haven't followed your instructions or achieved your objectives. Actually, you can go and buy a potty seat. You get those fiber ones or plastic ones which you can buy for your son or your daughter, and so they actually play with those potty seats initially. They sit on them, play horse while they're with their clothes on. They get familiar with it, so they don't get scared of sitting on the potty seat when they have to empty out. We can look at a child's expressions and understand that he or she wants to empty out. So at that point, take them into the washroom and place them on the toilet seat and encourage them to empty out. Those children that are constipated need to be helped with sitting on the toilet seat every day, even if they don't want to pass stool. So let them sit there for 10 or 15 minutes and we sit with the child, maybe play a song or read a book. So the body tends to recognize the fact that the child needs to empty out every day, and kind of the whole gastrointestinal system tends to cooperate with the child's mind and with the parent, and they tend to pass stools every day, and constipation is taken care of. So all of these measures, giving a lot of water to drink, avoiding only milk-based diets in toddlers, giving them more fiber in the form of grains, fruits, vegetables, avoiding stress in the family, avoiding anxiety in the parents. So all of these measures will help in toilet training as well as managing constipation. But in some cases that are resistant to even these measures, we may need to use stool softeners or laxatives for a short period of time. So polyethylene glycol, or PEG popularly called, is a good laxative, a good stool softener. It kind of pulls in water into the stool and makes it soft. It's available as a liquid as well as a powder. So the liquid can be given to children easily from 1 year of age. The powder needs to be mixed with either water or fruit juices and given to the child. It's usually given once a day in the prescribed amount, and you need to give it for a period of 15 days or maybe 3 weeks until the child has improved his diet, has improved his water intake, and then will naturally pass soft stools and will not use a stool softener. It's not a habit forming medication. It's given for treatment, so it's perfectly safe and it's very effective for use. So parents, in addition to all that I have told you today, you are very welcome to look at your own resources for more information, more tips. The internet is flush with information for parents. You have medical books for parents. You can read up and gather your own tips for toilet training and to manage constipation. But while you're doing that intellectual exercise, please do not forget to the emotional exercise of offering your child support, hugs, smiles, cuddles. Do a lot of that and ensure that your child cooperates in the process of toilet training and for the management of his constipation. Remember that your success lies in your child's success, and my best wishes are with all of you. Thank you very much.